Hello everyone, welcome to the webinar. Today's topic is the ABCs of LED, incorporating light therapy into your practice. This webinar is brought to you by the Aesthetics International Association and Dermoscope magazine, and it is also sponsored by cclluma. My name is Veronica and I have been an esthetician for over 11 years. I have recently joined the AIA and Dermoscope team and I will be the host for this webinar. This webinar is presented by Patrick Johnson and Pam Cushing. Patrick Johnson is the CEO and President of BioPhotas, Inc., and the inventor of the award-winning cclluma series of light therapy devices, with an extensive background in the medical device industry. Pam Cushing has over 15 years of clinical experience in the esthetician medicine and 30 years as senior consultant nurse at the National Health Service in England. She holds a master's degree as well as a postgraduate diploma in aesthetic medicine. This webinar is interactive, so we want to make sure you submit your questions during the presentation. We're going to use the last 10 minutes of the webinar for Patrick and Pam to answer the questions you've submitted. And thank you, cclluma, for blowing our registration numbers out of the water for our webinar. Please stay tuned until the end of the webinar to find out how you can get a bonus gift with purchase today only for live attendees. And without further ado, Patrick and Pam, I am turning the webinar over to you.
Thank you, Veronica. Welcome everyone to our webinar. We appreciate you taking the time. This is certainly an international event as we have people tuning in from around the world. And I'm coming to you from our California headquarters and Pam is coming to you from England. So we're excited to be with you this morning and very excited to have, as Veronica said, blown their attendance numbers out of the water with this presentation. Before we get into the webinar itself, we're also excited that Dermoscope announced on Friday that cclluma again is a winner of the Aesthetics Choice Award in 2020. In fact, we won 2 awards, the cclluma Pro for Best LED Panel and our new cclluma Deluxe for Best Full Body LED, which is particularly gratifying for us given that the cclluma Deluxe has already only been in the market for 6 months, and yet the readers of Dermoscope have recognized it as the best full body device in the market. So with that, let's get started into the presentation. What are we going to talk about today? Well, we're going to talk about understanding light therapy, why the science matters and how it works. We're going to talk about what makes the cclluma different from any other LED device available in the market today around the world. Then Pam's going to talk to you about how to incorporate the cclluma into your aesthetic practice, what results look like, what protocols look like, and how to use light therapy to build success in your practice. And then finally, I'm going to talk about frequently asked questions, or what we like to call LED fake news. There's a lot of urban mythology out there around the science of light therapy, most of it created by the marketing directors of light therapy companies. And we think it's very, very important that practitioners can distinguish between what is the science and what is just sales pitch. So with that, let's get into the science. So what is light therapy? Simply put, it's the application of specific wavelengths of light to tissue to obtain a therapeutic benefit. The research into low-level light therapy or light therapy devices emitting less than 1 watt of power dates back to the mid-1960s and the advent of cold lasers. But really the research we're interested in is more at the end of the last century, where NASA was looking as a part of its deep space exploration studies into a couple challenges. The first is how do you feed astronauts on the way to Mars and back when you can't send enough food with them? And what NASA discovered is that you can actually use high intensity absence of sunlight to grow food stuff. So problem solved. The bigger issue is when you put the human body into a zero gravity environment, it shuts down at the cellular level. Specifically, the mitochondrial process shuts down and stops producing ATP to drive normal cellular function. So when you put the the human body into a zero gravity environment, it essentially enters a state of hyperaging where you have suboptimal performance of the respiratory system, suboptimal performance of the cardiovascular system, bone entrophy, muscle entropy. Problematic if your career is being an astronaut. So again, NASA turned to light energy emitted from high intensity LEDs and discovered that exposing mitochondrial compromised tissue to light energy not only re-regulates the mitochondrial process, but upregulates it 3 to 6 times. So we go from a state of hyperaging to a state of accelerated cellular healing. So how does it work? Well, think of it as photosynthesis for animals, or at least mammals. Light is made up of small particles called photons. Those photons can penetrate human tissue and penetrate the cell wall, being absorbed in the mitochondria by the fourth molecule in the cellular respiratory chain, cytochrome C oxidase. That triggers an upregulation of ATP, and depending upon what cells we're impacting with light energy, there is a downstream cascade of metabolic effects in the body. So in aesthetics, what we're most interested in is fibroblast cells. Why? Because fibroblast cells produce collagen and elastin, the most important protein in connective tissue as well as skin health. And the truth of the matter is when we all reach about the age of 40, our fibroblast cells stop producing collagen and elastin. And that's why that old adage, we don't heal as fast as we used to, is true. In fact, you know, when we're 17 and we twist our ankle, the coach tells us to run it off. When we roll our ankle and we're 57, we call the orthopedic surgeon. Our body just can't heal itself the way it did when we were young. Deeper into the tissues, keratinocytes, mast cells, key in skin tone, texture, and clarity, as well as the inflammatory process, and then neutrophil cells and macrophage cells involved in the immune response. So having a beneficial and favorable biochemical reaction on the entire body. So what light are we talking about? We're talking about light energy inside and just outside of the visible light spectrum. So from about 400 nanometers, which occurs to us as blue light, to about 1,000 nanometers, which is near infrared and invisible to the human eye. Well, why that range? Well, because below about 400 nanometers, the melanin in our skin prevents the absorption of light energy. That's why we get skin damage. That's down below 400 nanometers is where UV light lives, okay? And we want to avoid that. That's not in low-level light therapy. Above 1,000 nanometers, the water in our tissue prevents the absorption of light energy, and in turn, we get a thermal event. We get a warming of the tissue, which is absolutely therapeutic, but it's not triggering that biochemical reaction we're after. It's not upregulating ATP in the cells. Penetration is a function of wavelength. The longer the wavelength, the deeper the light energy penetrates. So if we're treating conditions at the surface of the skin, we want a very short wavelength like blue. We don't want the dose being delivered deeper into the tissue. That's why we associate blue light with treating acne, because the P. acne bacteria is on the surface of the skin. Deeper into the tissue, we use red light, which penetrates between 2 and 8 millimeters below the surface of the skin, where all those fibroblast cells live. And that's why we associate red light with wrinkle reduction or anti-aging, because we're delivering the majority of the dose of the light energy to the depth of the tissue where the fibroblast cells are. And then deep penetrating, near infrared, as deep as 25 millimeters below the surface of the skin, down into the subcutaneous tissue, knocking down inflammation, increasing local circulation. This is really the aches and pains wavelength. So if you're looking at what makes an efficacious light therapy device, you're really going to look at four things. First is wavelengths. And if you look at the clinical literature related to low-level light therapy, by far, blue, red, and near infrared are the wavelengths supported by the clinical literature. Now, while you may find devices out there that have amber light and green light and pink light and white light, and you may even get anecdotal results from those, the clinical literature clearly bears out that blue, red, and near infrared are optimally absorbed by cytochrome C oxidase. So you want to be looking for a device that has those three wavelengths, and ideally all three. Then we go to energy delivery. And the clinical literature bears out that if you want to be upregulating ATP in the mitochondria, you need to be delivering between 2 and 10 joules per centimeter squared of light energy. So it's not about how much power the device emits. It's about how much energy is available for the body to absorb. And that's between 2 and 10 joules per centimeter squared. A joule is essentially a measure of energy. It's 1 watt of power times time times area. Square centimeter, for those of you in the US, about 3/8 of an inch by 3/8 of an inch. So why that range? Well, because below 2 joules per centimeter squared, you're not providing enough light energy to trigger that biochemical response, that upregulating of ATP. And above 10 joules per centimeter squared, you're potentially overstimulating the cell, providing too much and potentially creating a toxic event. So this is what we call the biphasic dose response curve. Essentially, if you take all of the clinical literature and all of the benefits provided by light energy, you're going to find the optimal dose falls between 2 and 10 joules per centimeter squared. Again, because below that, too little light energy can be ineffective, and above that, the light energy can be toxic to the skin and cause damage. Now, treatment time is related to energy delivery, but it's important to recognize that there's not a reciprocal relationship between energy delivery and time. You can't reduce time of a light therapy treatment by just delivering more light energy, because as I just said, delivering more light energy has the potential of creating a toxic event. So if you have a device that's delivering between 2 and 10 joules per centimeter squared, your treatment time is going to be somewhere between 20 and 30 minutes to deliver a full efficacious dose. And what I mean by that is a dose of light energy that's going to produce up to 48 hours of residual upregulated cellular activity. Now, again, you're going to find light therapy devices on the market that say, you know, you only have to use our device for 3 minutes or 5 minutes. We have so much power, we can reduce our treatment time. But that is just not supported in the clinical literature. And in fact, with a shorter treatment time and more power, if the device actually emits more power, is potentially going to do more damage than benefit. And then finally, you have proximity to skin, or what we call emissions proximity. Now, my background prior to founding BioPhotas was in orthopedics. And in orthopedics, we use thermal devices post orthopedic surgery to manage pain and reduce swelling and inflammation and accelerate healing time. And those devices wrap the area of treatment very closely. So when I looked at the light therapy devices on the market, it struck me odd that those devices were flat, rigid panels that hung inches over the area of treatment more like a French fry warmer or a chip warmer than a medical device. And it just struck me, intuitively that a light therapy device should contour and shape to the area of treatment. And it turns out my intuition was supported by a law of physical optics, or specifically the inverse square law, that states as you double the distance between a surface of absorption like the skin and a source of light energy like the cclluma, the amount of energy available for absorption diminishes by 4 times. Let me say that again. As you double the distance between a surface of absorption and a source of light energy, the amount of energy available for absorption diminishes by 4 times. And as I stated earlier, it's the amount of energy available for absorption that's the key, not the power being emitted by the device. So here's a great illustration of that. On the left, you see the cclluma traditionally tinted over a face, and on the right-hand side, you see a device of a competitor's also positioned tinted over the face. But if you look at just the distance between the device and the nose, in the case of the cclluma, it's only a ½ inch away. In the case of the competitor's device, it's an 1.5 inches away, or 3 times the distance. That means that device on the right-hand side has to be 9 times as powerful to deliver the same amount of light energy that the cclluma is delivering on the left. So more power, more expense, more cost for you, and the potential that if you move that device closer to the skin, it's actually going to create a toxic event. So really, the key to effective low light therapy is delivering a low dose over a longer period of time to have the most benefit and avoid damaging the skin. So what makes the cclluma different? Well, it's the only flexible 3-in-1 panel on the market that is FDA cleared for treating acne, for treating fine lines and wrinkles, for treating aches and pains, and outside the United States, it is medically CE marked for dermal wound healing, including diabetic lesions. We use all 3 wavelengths in all 3 programs, but we change the density of the program so that the light is dominant in the depth of penetration where we're targeting the condition. So in our acne program, we're blue light dominant because we want the majority of the dose delivered at the surface of the skin. In our wrinkles program or our skin program, we want the majority of the dose delivered between 2 and 8 millimeters below the surface of the skin to stimulate all those fibroblast cells. And in our aches and pains program, we're infrared dominant because we want to get deep into the tissue. We want to activate microcirculation. We want to knock down muscle spasm. We want to knock down inflammation. So you get everything in a single device that contours and shapes to the area of treatment, so we deliver the optimal amount of light energy without risking damaging the skin by overpowering the cells. The cclluma is a versatile device. It can be used anywhere on the body by anyone in the family. So it's a whole family, whole body therapy. You can see it there at the top left, wrapped around a hamstring, maybe a runner, traditionally tinted on the lower left over the face. It is the only device that can treat the face, neck, and décolleté all at the same time, wrapped closely around the face at the upper right there, and then over a shoulder complex on the lower left. So anywhere on the body without concern. Here you can see treating the feet by sitting and placing your feet on the device, or treating the backs of the hands, that crepey skin on the backs of the hands, by just laying the device over or wrapped around small joints like the wrist or the elbow. We really have 3 different families of products. Our larger professional panels, the cclluma Pro being our flagship, our most popular device. which can both be traditionally tinted over the face as well as covering the face, neck, and décolleté, wrapped around the back, over the shoulder complex. Our smaller at-home devices, which over the face are positioned on facial rests to get the same positioning as the cclluma Pro over the face, or as you can see, again, wrapped over a shoulder complex. And then our handheld device for really targeted conditions, the cclluma Pod. It has all the functionality, all the power and efficacy of the cclluma Pro. It's just a tenth of the size. And then finally, our award-winning cclluma Deluxe, which is available in 2 sizes. Think of it as a heavy blanket that you would use on a massage table. It lays on the client or patient, and then they can just turn over and get a full body treatment on the front of their body as well as the back of their body, and can be used in conjunction with the cclluma Pro to be able to do a full body treatment as well as a facial. So with that, I'm going to hand it over to Pam to talk about the clinical application. But I just want to remind everybody, please stay on the webinar until the end. We've got a bonus gift if you purchase today as a live attendant, and we'll give you the details of that at the end of the webinar.
Patrick, thank you so much for your insightful presentation with regard to the science. It's absolutely fascinating in terms of understanding the history behind how light therapy has migrated from the astronauts into aesthetic practice, but also the benefits in understanding the true benefits with regard to cclluma and the science and the research. Welcome everybody, and thank you very much to both Bespoke and to Patrick and Denise at cclluma for inviting me to be part of this webinar. I'm very excited. So I think for me, it's about looking at what it is about LED, and particularly in cclluma, that I love so much. I've been involved with light therapy for a long time, and I've tried pretty much every device on the market. And one of the things that I love so much about cclluma, which is my preferred light source of choice, is that, you know, more than anything, it's so versatile. Patrick has gone through all of the availabilities and the certain areas that you can use it. It's an affordable device, not only for yourselves as aestheticians in terms of its purchase, but also affordable to your clients. My clients absolutely love it. I have people banging on my door all the time wanting to come in for their light treatment. There's no social downtime involved, which is one of the great benefits. They certainly see a massive improvement in their skin in terms of the luminosity, the radiance, the overall health. What it does more than anything for my business is it certainly increases my income. It reinforces loyalty to my clients. They know that I'm offering the best treatments possible at an affordable price that's not going to scare them, and very much creates a unique experience. One of the things I also love about it is that it's very easy to use. It's not space occupying at all. You can hide it in a cupboard, you can hang it up, you can store it very easily. The fabulous thing about transportation is I have the ability to take it home and use myself, which has got to be a bonus. All right. I incorporate light therapy and certainly the cclluma with a lot of my procedures that I do. It is my go-to. It's something that I would always say sort of pretty much pre-charges whatever I'm going to do in terms of my treatments, so that they're going to get visible enhanced results. And for anybody who's involved in aesthetic treatments, we all know that combination treatments will give us the best results. Happy clients means happy Pam. So if we just go on to looking at this, that we need to just show you which way we go forward. All right. So one of the things that I'm sure presents to a lot of you is the problem with regard to acne and problematic skin. I'm sure it's exactly the same in the US as it is here, is that we have a lot of problems with acne treatments. So what I'd just like to share with you is certainly looking at these images, is that, you know, quite clearly we can see that's probably a grade 3, probably a grade 2 acne, somebody who's obviously problematic. So if we look at the date, we've got May 19th with this young lad with his acne problems before cclluma. And then when you look at the time, we've got 5 weeks later. Now, this young lad was having ccelluma twice a week for 30 minutes, the full set time. No other treatments were given, all right? No other modalities in clinic. The results speak for itself. And I think for all of you who are looking at that, if we can achieve that kind of treatment that's very affordable to this client base, particularly for those that are cash poor, as we would call them here in the UK, to get this dramatic improvement in the integrity of the skin, more than anything else, will have an amazing psychological benefit to this young man. All right, I just absolutely love it. So standalone treatments for acne is amazing. The next one we have here is again showing you, difficult to describe, certainly where we're looking at with this lady. She's probably more of a hormonal involvement with regard to acne if we're looking at the lower jaw. So again, same principle here. We've got ccelluma. This one, again, twice a week, done for 8 weeks. All right, there's been no other modalities used, and we'd like to thank Laura Kitzman for allowing us to share these images. And I think what you can see there more than anything else is a dramatic improvement in the overall integrity. There's a certain amount of inflammation that's still present there, but in terms of acne scarring, we've dramatically reduced it just with our light therapy. And for me, this is just, amazing, incredible results. Okay, looking at the way I manage my acne patients, certainly, having a standalone ccelluma does help. It works very well, but we all know that these clients are wanting faster, more accelerated results. Okay, some of them are happy to just proceed on a 4, 5 week, 8 week program, but a lot of them, because of the psychological and the social impact that these kind of skin disorders will present with us, they're wanting quicker results. So I generally tend to manage them in terms of my acne treatment, and it does vary depending on what I'm dealing with, to be fair. Skin changes, we all know that. Gently we'll cleanse, we'll exfoliate, probably degrease. A lot of these will have an oily panel and certainly be having residual oil. So I'll probably degrease with some isopropyl alcohol, and then I will place them under the light at the start of the treatment. They'll have the 30-minute program, and then depending on what I'm trying to manage, if it's just the acne, then I'll probably do a certain amount of treatments with incorporating some alpha hydroxy, maybe a little bit of beta hydroxy acids. If they're a skin type where there's a propensity maybe for some post-inflammatory hyperpigmentation, I might be incorporating some acids that will help reduce the tyrosinase, help to lift the pigment, and certainly vitamin C as a boost post-treatments, I find absolutely amazing. I can do some spot treatments, but one of the things I do like to do, and I'm starting to do this a lot more, I've been introduced to a what we call touch therapy massage. And this is slightly different from a facial massage that we may all be used to doing. And this is specifically designed to actually target the Chinese acupressure points, as well as deep muscle massage. The benefits of targeting specific acupressure points is that we know certainly with acne, there is a huge influence with regard to gut health as well. There's also hormonal influence. So certain acupressure points will target the endocrine system, the pituitary, where of course all hormones are produced, looking at the gut, and obviously with regard to liver and elimination. So touch therapy I find is very, very helpful. It's not a relaxing treatment. They certainly feel it, but it certainly brings a benefit to the treatments that I do. I'll then calm the skin down, hydrate it with some moisturizing cream, and then obviously they go home with sun protection. We then will book them in for another treatment, depending on what I've done. That could be a week. If they feel that they want to, what I do have is I have the opportunity to actually allow them to hire out a ccelluma, which they would use at home. So they can continue to just use light therapy at home, and I would just see them with the in-clinic treatments with the benefits adding into it. Okay, with regard to anti-aging, and I think that this is a thing that probably is the bulk of our work that we do, is women are looking for aging treatments, trying to slow down those natural processes that are going on, reverse the sun damage, reverse the neglect that we sadly all do as human beings, as we don't respect the largest organ of our body. So looking at this lady, what you can see here before the cclluma, she's obviously got a lot of photoaging that's going on. The skin looks slightly dehydrated to me. It needs a little bit of love. Okay, so we're looking at the protocol that we've had here for this lady. She's had the cclluma only 3 times a week for 4 weeks. What's very interesting is that actually what you can see is one of the things that we perhaps don't take into consideration is even after the final cclluma treatment, because of the stimulation of the fibroblasts and the continuing production of collagen type 1, is that they will still continue to get continued benefits after the treatment. So her after photograph here was taken 12 weeks after her final cclluma treatment. So that's one of the things I think that we need to be thinking a little bit more when we're talking about the treatments, is that the benefits will continue to prove over the subsequent weeks. And that's the wonderful thing about the stimulation of those fibroblasts, the collagen production, and the stimulation of the mitochondria, is that this continues to work long after we've stopped our treatment. And I think you should definitely notice the difference. One of the things I find very interesting looking at this is that if you actually look at her eyelids, particularly her right eye, which would be left if you were looking at it now, the lift that we've got in her brow, the lift in her mid-face, the improvement in her lower face and her marionette lines, you know, after just light therapy. I mean, this is magic in a panel. I can't tell you how much I love the cclluma. So again, looking at more focused and target areas, I mean, it's probably best to treat globally, but if you've got an area that you want to see a great improvement, if we look at these images, and thank you very much to Laurie Hall for allowing us to use these, is that we've obviously got a lady who's the typical problems of ladies with aging. We're beginning to lose the definition of our lips. We're developing those fine lines. We've got those nasolabial folds, certainly a loss of collagen in our lower marionette lines. And actually what you can see here is that this is an 8 weeks post-treatment. So she's had 4-week treatments over an 8-week period. Yeah, so twice a week for 4 weeks, and that image was taken 8 weeks post-treatment. And my goodness, you know, the improvement in those oral commissures, the fine lines on her upper lip, you can see the improved definition of her lips. So, you know, this is lip fillers without fillers. What's not to love? Okay, I'm very impressed with this. It looks amazing. It firms all the skin and the fine lines. Okay, so, oh, apologies, I'm just going to move back. So just talking again about my signature treatment that I would do with regard to age management. All right, again, you know, cleanse, deep cleanse. I desperately encourage my clients to come in, if they can do, to come makeup free, all right? Otherwise, I'm spending 2 or 3 times cleansing. I'll then exfoliate. It certainly helps with penetration of the wavelengths. And I will degrease as well. Even though I've done a good cleanse, I will still degrease. I need to be absolutely confident that there is no invisible barrier to the penetration of my wavelengths. I want to be absolutely sure every single light that is going through is penetrating into the skin. So we'll have it on the red dominant or the wrinkles mode, and it will be on a program for 30 minutes. I see zero benefit in reducing that time for 20 minutes, even 10 minutes. You can do if you want to. I think that's your choices, but I'm wanting the full benefit of my light. So it's 30 minutes, all right? Depending again, what I'm targeting will determine what I'm going to do with regard to treatments. I use a lot of alpha and beta hydroxy acids, but I'm very selective about the blend and what I use. I might be specifically targeting the fine lines and wrinkles. I think in older ladies, pigmentation and age spots can be a bit of a problem. So I may blend and mix and put something in that will help me lift epidermal pigment, try and slow down the melanosome transfer so that we're getting a much more even radiant tone in this aging skin. And again, I'll introduce touch therapy. All right, touch therapy again, working on those acupressure points where you were very much trying to stimulate, all right, looking at the gut health as well, because I think the gut health has a huge influence on skin. Looking at how the stimulation of the liver to eliminate the toxic, you know, byproducts of cellular metabolism, and generally targeting those fibroblasts, but as well as tightening elastin fibers. End that with a nice calming, hydrating cream. You can use a, you know, a hyaluronic acid gel mask after that. And then obviously they would go out with UV protection. Treatment lasts a little bit of a long time, but it absolutely is amazing. And they're banging on my doors wanting their next treatment. Okay, so looking at how we introduce cclluma when we're using it with combinations, and I love using it post microneedling. There can be a lot of discussions about microneedling and should we reduce inflammatory processes, whatever. And I think it's all up for discussion. But if you look at this first image, okay, this is a lady who's just had microneedling before her cclluma. And you can see what she's got is a discrete erythema across her face. All right, if we actually look at her after image, I don't know if you can see this terribly well. What I can see is definitely we've had a reduction in that erythema, that redness. But actually what I can see is an overall brightening and radiance of that skin of color. All right, they're difficult people to manage. We need to be careful. We're worried about post-inflammatory hyperpigmentation, which of course is a real problem in these higher skin types. And I think reducing that inflammatory reaction to calm it down, I think is amazing. It's brightened, and in my view, it's evened out her skin tone. And one of the things, and people may look at it, is actually if you look at her upper eyelids, where she's got that element of slight discrete pigmentation, we've definitely had a lifting and a brightening, which has come through from obviously the cclluma, because we've not microneedled her upper eyelids. And I just think it's amazing. And that'll be 30 minutes under the cclluma. Okay. These photographs are a bit scary, and I apologize if anybody's a bit squeamish, but this is really just to show you the benefits of the versatility of cclluma and light therapy in managing wounds and healing. All right, I'm going to let you read that little box to the side, but what you can see is a lady, obviously in that top left-hand box, who has got a terribly, terribly traumatized face. Yeah, she's had an upper blepharoplasty, and she's obviously had some deep laser resurfacing. So what we've got there, to all intents and purposes, is a second-degree burn. All right. What we're looking at is that this lady was put under light therapy by Cindy Tenbrook. Thank you very much for allowing us to share these images. And this was twice a day for 2.5 weeks. And we've got the improvement. The lady went for a checkup a month later with her surgeon, and the surgeon was amazed that the improvement and the acceleration in the healing process following that rather traumatic treatment has blown his mind away. His words were, "You look like you should have looked at the 4th month mark, not 1 month post." So it has a massive benefit in acceleration of wound healing and improving that barrier. You know, this is horrific. And actually, if you look at her last image, virtually no scarring at all, which would be one of the concerns for all of us looking at that top photograph. Lots of sleepless nights for us if we're looking at that with our patients. You know, post-inflammatory hyperpigmentation, scarring. But as you can see from that last one, you know, an absolutely incredible. So consider looking at thinking outside of the box with cclluma. It's not necessarily just for our skin rejuvenation and for acne, but also looking at for wound healing. Incredible, and not just necessarily on the face. A lot of our plastic surgeons that are here in the UK are actually looking at integrating cclluma as part of post-surgery scar management and healing. And this to me is very exciting. I love the versatility of cclluma. Our next one is actually looking again about wound healing. And you can see this is actually a scar that's 3 weeks post-surgery, which you're showing that there's very little sign of improvement. There's very little adhesion with that wound. It doesn't look like it's going to knit and unite very well. It's had regular cleaning, but has showed very little sign of actually improving. The right-hand image that you can see there is that we've needed a pen to actually show you and identify to you where that scar is present. And this is after several weeks of cclluma. So you've got accelerated wound healing. You've got general improvement. If you look at the skin area around that scar, you've got a lot of pigmentation. The skin is dry, it's dehydrated. And clearly the effects of cclluma on wound healing, I think, speak volumes. I don't think I need to say any more. Okay, as Patrick was saying earlier on, has been CE marked in Europe here for wound healing. So I think that's a great credit to cclluma and its power and its benefits. Looking at it in terms of scarring, you can see this lady on the left-hand side there. She's got a fair degree of, fine lines and wrinkles with regard to, natural skin aging, but she has a rather deep, old scar between her mentalis muscle and her lower lip. All right, so it's how does this improve scarring on clearly an old scar, and not necessarily how we're looking at it in the previous images with regard to accelerating wound healing. And what you can see here is that she's had one cclluma treatment twice a week for 4 weeks. Yeah, no other modality used. Now, if you look clearly, the scar is still present, and there may be certain ways that you may have improved that if you wanted to induce another modality, I'd certainly consider microneedling, maybe some chemical peeling included with that. But this just shows you the benefits of just the application of the cclluma light twice a week for 4 weeks, no other modality. You've got a definite improvement in the overall integrity of that lower face. You've got plumping, you've got a reduction in those fine lines and wrinkles. So by definition, the appearance of that scar appears to have improved. Okay, it will have improved a little bit, but actually if you increase another modality into there, we may have probably got a better result. She's delighted. And again, thank you to Laurie for allowing us to share these images. I'm sure you can all agree that this is an amazing improvement on just light. We look at it because we've obviously got a mode on our cclluma for aches and pains. And this is an image of a plastic surgeon, if my memory serves me correct, who fell at a conference opposite the cclluma stand. So you can see that he's got a fair degree of bruising on his left hand. I think it's his left. Yes, it is. Yes, it is. And obviously a certain amount of skin disruption. Cclluma was applied after the injury for 30 minutes, and that's the improvement that you've got. So you can definitely see an improvement in fresh bruising. All right, you can see that certainly around where you've got the areas of break, and certainly where his watch is that you've got a massive improvement. You've got a reduction in the amount of bruising. You've got a definite improvement in the wounds. And I think if we applied the cclluma to this person, maybe for a couple of days a week, that within about a week, maybe 2 weeks max, we probably would have had complete resolution of that. So again, it shows you the versatility of you can use it for short-term injuries. A great result. Okay, so looking at how we can, I've mentioned this before about incorporating it with other modalities, and certainly it does have a benefit. I think we all know that combination therapies will always give us better results. So using the cclluma, you can have it following it or pairing it with your waxing, your laser hair removal. That will certainly help to reduce inflammatory processes that are going on down there. Benefit chemical peeling, IPL and radio frequency. Certainly a lot of my colleagues who are in the injectable business will use it as a bolt-on for their Botox and their dermal fillers. We can certainly use it for dermaplaning. I find with dermaplaning there is a tendency in certain skin types to create a massive inflammatory reaction going on in the skin. So actually using the light therapy to calm that inflammation process down will certainly help. It's been used for laser liposuction, laser resurfacing, and definitely a benefit with regard to post-cosmetic surgery wound healing. I love it for microneedling, microtanneling, microdermabrasion, and microcurrent. I think its benefits definitely give us better results. You can use it pre and post procedure. I have a tendency all the time, and I know people will practice differently, and that's the beauty of being independent, free-thinking individuals, is I will always use it before any procedure. Okay, I can use it on the face and the body. I do a lot of treatments with regard to stretch marks where I use microneedling and chemical peeling, and I'll also use my cclluma to support the collagenesis. And certainly if you've got enough room, if you've got somebody there, the patients are waiting, you can certainly occupy them time. Instead of them sitting there reading all your beautiful magazines, you can just pop them under the light prior to them coming to see you for their treatment. It certainly saves your time. Okay, so looking at suggested pricing, I mean, these prices that we've got here are obviously the US guide, But I have to say, looking at the pricings, they're comparable to what we're charging here over in the UK, all right? An express treatment of 45 minutes, okay? That's generally will go be your cleanse, your degrease, prepping, little chat, and then 30 minutes under the light, hydration, and then sun protection, all right? Generally, what you could be doing is looking at, if it's a short period of time, taking off 25 to 30% of your regular price. For me, with an acne facial treatment where I'm incorporating things, it's about an hour. So depending on, you know, the type of person I'm dealing, I'm looking at, in our money here, it's £75, you know, US dollars, it's obviously 75. Okay, if I'm doing a very express facial where the time is very short, I'm not incorporating my touch therapy or doing a lot of additional treatments, then I'll obviously reduce it to £55. Okay, sometimes what I'll do is I'll bundle up a treatment program for them, and I'll reduce accordingly, maybe throw in 1 or 2 free treatments. We all know everybody loves a free treatment. Okay, you can certainly use it to upgrade whatever signature facials and treatments you're doing. You can add it in, you know, pre-peels, before your microneedling, before your dermaplaning, remembering that it's adding in your time. Okay, and with my anti-aging facial, I will generally charge anything from £100 to £150. I think it very much depends on what I'm doing and what I have with my time. So, you know, an hour to an hour and a half, I'm probably charging about £150. And most of my patients consider that to be exceptionally good value for the benefits that they get. So, you know, they're always banging on my doors, wanting more treatments. Okay, so as I said, you know, you can put it as a series. I find that works very well. It certainly endorses a commitment for them, that it's not a one-hit wonder. I do say to my patients, if cclluma worked in one shot, you wouldn't be able to afford it, because miracles are very expensive. Okay, so I'll generally set them a treatment looking at maybe anything from 4 to 6 weeks, depending on what kind of skin condition we're dealing with. And as an add-on, you know, I think you look at your time, it's occupying time, and how much you kind of want to earn and generate in that time. Okay, so I think at that point I've probably said what I need to say. Thank you very much for listening to me. And I'm going to hand over to Patrick now, who's going to talk to you about how you introduce it and the support that you'll get through cclluma with regarding to your marketing strategies. Thank you so much.
Thank you, Pam, for a great illustration of how valuable the cclluma can be in an aesthetic practice. And oh, by the way, I'm going to steal that miracles is expensive line.
You can have it with my pleasure.
So, you know, and again, thanks for the great segue, because the best way to introduce LED in your practice is to give it away. Give it away, give it away, give it away. Once your clients, your patients experience low-level light therapy, they're going to want to have it again, and they're going to be willing to pay for it. Particularly your existing clients, when you incorporate it into the therapy they're already getting from you, it's just going to enhance the results, and it's going to convince your clients that they want to add it to their treatment every visit. It's great to introduce it post-waxing or threading. 5 to 10 minutes of light therapy will knock down that redness and that swelling associated with those procedures. Make sure you remember to use it on the massage side of the house. It's great cross-marketing that you can be providing aesthetic procedures by the massage therapist, and then also aches and pains treatments by the estheticians. Like we do at our trade shows, leave it turned on in your waiting room, and people will ask you about it. And again, you know, give it away. That's the best way to introduce it. When you buy a cclluma, it is the start of the relationship, not the end of a relationship. We believe that we are only successful as a company when you are successful in your aesthetic practice. And so we provide you with a plethora of marketing assets. When you buy your cclluma, you get a link to a Dropbox, and that Dropbox is basically everything that's been in this presentation, waiting room testimonials, written and in video, use videos, a waiting room introductory to low-level light therapy, posters, brochures. You can just pick and choose and print out what you want, given how you think that's going to work in your particular practice. cclluma is in the news, and we are in the news because we are the recognized leaders in light therapy and light therapy experts. Everything that gets talked about, the cclluma gets talked about from a scientific basis, and we're proud that we believe that the aesthetic practitioner needs to understand the science to really appreciate light therapy and the cclluma in their practice. We're most proud of the most recent award we got at the end of 2019, which is the Aesthetic Journal's Light Therapy, or excuse me, Innovation of the Year. We were pinned up against, or set against all of the aesthetic treatments in the UK market, and came out on top, not just of the light therapy, but of all aesthetic treatments. And so one of the things that comes up is in the frequently asked questions is really sort of, are competitors selling against us with mythology rather than science? And one of the things we hear is that different wavelengths interfere with each other. And if we were talking about lasers, that would absolutely be true, but we're not. We're talking about LEDs, and different LED wavelengths do not interfere with each other. And the reason for that is laser light is collimated or coherent light. That means all the photons are moving in the same direction at the same rate, or what's called in phase. With LEDs, the light energy is out of phase. The photons are moving at different speeds, in different directions, and so introducing multiple wavelengths can't disrupt something that's already disrupted. We get competitors telling us that their prescription or RX clearance of their device is more professional or more efficacious than an OTC clearance, and that's just absolutely not the case. Typically, the way drugs or devices are cleared through the FDA is they're first cleared on an RX basis where it requires a script, and then the sponsor of the device has to submit to the FDA additional data, specifically self-selection and usability data that supports a non-clinically trained person's safe and efficacious use of the device. And so we've done that in the case of the cclluma, and have proven that not only is the cclluma effective in the hands of a professional, but also safe and effective in the hands of a consumer. We're hearing a lot about LEDs increasing serum penetration, and a pivot on the part of other light therapy companies towards serums to be used in conjunction with their light therapy treatment. And we've reviewed probably 5,000 clinical papers on light therapy, and we see no robust clinical literature that supports the synergistic use of light therapy and topically applied serums that results in the increased penetration of the serum. Our skin is the most miraculously designed biobarrier ever, and it's designed to keep things out. The molecules in topically applied products are just too big to somehow be pushed deeper into the tissue. More importantly, light therapy is penetrating as deep as 25 millimeters down into the subcutaneous tissue. When topically applied products, you know, if they work well, maybe 1 or 2 millimeters. So why would we ever impede the penetration of the light therapy by putting a topically applied product on the skin? You want to provide light therapy on clean, dry skin. That will vitalize the tissue and theoretically make your subsequently applied topicals more bioavailable to the body. What about green light and hyperpigmentation? This is really sort of a dual myth. where one, we believe that hyperpigmentation can be treated effectively by green light therapy, and two, that you actually want to avoid light therapy because of its potential to create hyperpigmentation. And neither of those myths are supported in the clinical literature. Some of the best research into light therapy and hyperpigmentation is out of McGill University. Dr. Daniel Barrelay, the director of dermatology at McGill University's medical school, has actually demonstrated that heat, at least the kind of heat created by LED devices, can't create hyperpigmentation. Hyperpigmentation is a function of sun damage or hormones or pregnancy, but not heat, unless we're talking about the kind of heat produced by a laser. And that if you want to treat hyperpigmentation with LED, you want to use red and near infrared light, that there's nothing to support that green light treats hyperpigmentation or anything else. Can the ccelluma panel touch the skin? Absolutely. The closer the better. The only time you wouldn't want it to touch the skin is when you have concerns about cross-infection, cross-contamination following deep ablative or surgical procedures. In that case, you want to sort of back it off the skin slightly, but still have it close enough where the body can absorb as much light energy as possible. We actually make disposable hygienic barriers that can be thrown away after use, or you just wipe the panel down with a low alcohol, non-surface disinfectant to keep it clean between patients. Where is it made? It's actually made here in Southern California where we're based. One of our competitors likes to tell people that the ccelluma is made in China, and it's just not. It's made proudly here in the United States. And then finally, you know, are more LEDs better? You'll have somebody say, we have 1,800 LEDs, therefore you only have to use our device for 5 minutes. Well, none of that is supported in the clinical literature, as we discussed earlier in the presentation. It's not a question of how many LEDs or how much power, it's how much energy is available for the body to absorb, and we know that that's between 2 and 10 joules per centimeter squared. While we love making people beautiful and enhancing skin health, what we're really most proud of here at BioPhotas is our collaboration with the Semper Fi Fund in providing the ccelluma to wounded and injured service personnel who are having to leave the military because of those injuries or wounds. We all know about the crisis in addiction to opioid medications, and we're fighting the ccelluma to wounded warriors. We're able to keep them off those opioid medications and have them get the holistic therapy they need, not only physically, but emotionally following traumatic injury. Again, you know, ccelluma is the esthetician's choice and the market leader in light therapy, not because we say so, but because you say so. We've swept the aesthetic awards by all the major journals in the United States several years running, but awards not only in the United States, but also in the UK. So we're the recognized global leader in light therapy. And with that, I'm going to turn it back over to Veronica.
Hello, give me just a second here. I'd like to say thank you, Patrick and Pam, for your time with us today. And now let's move on to the first question. Patrick, what's the difference between the infrared used in ccelluma and the infrared used in a sauna? Great question.
So we need to remember that in low-level light therapy, we're using near infrared wavelengths. Those are wavelengths approximately 900 nanometers. In infrared saunas and infrared lamps, those are thermal devices. They're using wavelengths, infrared wavelengths that are up to 10 times as long as the near infrared wavelengths. And they're using that to warm the tissue. So sort of think of it as microwaving your body. So significantly different because the body can't absorb the energy from the long or far infrared wavelengths as opposed to the near infrared that we're using in the cclluma.
Okay, and Pam, would you recommend using the wrinkles red dominant program setting after a chemical peel?
Personally, no. I would probably use it before a chemical peel. And one of my rationale behind that is that light may have a tendency to potentiate the effect of an acid. So for me, where safety is so important, I would use my cclluma prior to the application of a chemical peel.
Okay, thank you. And Patrick, how do I clean my cclluma in between patients?
Right, as I mentioned, you want to use a low alcohol, non-bleach surface disinfectant like a cavi wipe, or if you want a very affordable product, 7th Generation makes a surface disinfectant wipe that's available at Target and most grocery stores. Just wipe it down in between patients and you'll kill all the bugs and germs.
Okay, thank you. And Pam, is light therapy safe and recommended for all skin types?
The short answer to that question is yes. Because we're not creating, I mean, I don't know what else to say. The answer is yes. Completely safe for all.
And Patrick, does the company provide cclluma training?
Yeah, we actually provide videos that are available. We have webinars that are available, the use of the device. And actually in the UK, we have level 4 training that Pam teaches for us. So if your insurance company is looking for advanced certification in the modality and the use of the device, that's available as well.
Okay, and also, do my clients need to wear goggles?
You know, there has not been a single report of an adverse event to the FDA of a LED device and retinal injuries. In fact, there's actually some really good clinical research out of DARPA, the Department of Defense Development Group, showing the use of low-level light therapy to accelerate the healing of retinal injuries. So LED light is safe, at least at the densities in the cclluma. Having said that, it's really bright. And so if you have clients who are hypersensitive to light, if they like to wear sunglasses indoors, they're probably going to want to use the goggles. I always try and treat someone first without the goggles, and then if they report after a couple minutes it's too bright, then we'll go ahead and place the goggles. But we want to treat the eyelids, so better without the goggles.
Okay, and one last question.
I'm just going to interject there saying, particularly for my older ladies where the upper and the lower eyelids are the most difficult to treat in terms of rejuvenation, if they can tolerate the brightness, they're definitely going to get an improvement in their upper and lower eyelids. So that's probably what I try and encourage them to do. Thank you.
Thank you, Pam. Okay, what are the contraindications for LED?
Great question. So there are 4 of them. A patient with a history of epilepsy or seizures. Those people have bad wiring and you want to keep any kind of energy device away from them. It doesn't matter what part of the body. Anybody on a light sensitive medication as labeled on the medication. If it says, you know, don't take this medication while you're or don't go out in the sun while on this medication, or don't go in a tanning booth while on this medication, you probably want a 1-week washout before you use low-level light therapy. Pregnancy over the belly or over the breast when lactating, anywhere else on the body is fine. And not because we know that there's some potential harm over the belly or over the breast, it's just that the FDA sort of treats those groups of patients as special, and you have to submit extra data on those indications and, you know, who wants to be in those studies. And then the final thing is over a known tumor or metastases. Again, nothing in the clinical literature that says low-level light therapy does anything to accelerate the growth of cancer tumors. But again, if you want to make that claim, the FDA requires that you do the studies. Interestingly enough, in the clinical literature, actually the original clinical literature showed that low-level light therapy does nothing to cancer tumors. And then, oh yes, at the last trade show in the bar, we came up with the 5th contraindication, which is do not ever lend your cclluma to a family member because you will not get it back, particularly your mother. Do not lend them your cclluma. You'll have to buy another one.
Thank you. And I would like to thank everyone for joining us today. That is all the time that we have for questions. And if your question was not answered, someone from the cclluma team will reach out and respond to your questions. If you have any questions for me, you can reach me at veronica@dermascope.com. And for today's live webinar attendees, cclluma is offering a free cclluma carry storage bag and a free face, neck, décolleté positioning stand with any cclluma Pro or cclluma Skin purchase by March 6, 2020, a total value of $70. And thank you again for joining us today.